Hey, Dan. So a lot of people are, this is just common in any dental practice. You have a light schedule. It's either on doctor side or hygiene. What are some suggestions to get slots filled, to get the schedule filled up?
Yeah, well, you need bodies in the shop, right? That's a colloquial term we use here in the management system. So bodies in the shop, patients in the door. You got to get people coming in for no matter what, whatever it is, whether they're paying or not, you got to get people into the organization. Those slots that get filled easy for a dental practice is, of course, hygiene. So people coming in, getting their cleanings. Certainly anybody who has outstanding treatment. So the outstanding treatment list, you could print that off and you'll see there's a bunch of people. There's generally, I won't tell you what we generally find as far as dollar value, but it's a lot sitting in outstanding treatment. So those are two immediate. Then of course, those people that they're sitting out there and they haven't come back in a while. That's probably the lowest hanging fruit. We call that somebody who's gone inactive, and there's lots of different definitions for inactive, but in a dental practice, somebody who hasn't, showed up for their routine hygiene visit. Their recall appointment came and went and they missed it, whether they haven't been in the practice for 8 months or 8 years, which you've seen, doctors, owners, managers, you've seen this. You want to go for the lowest hanging fruit. What's the quickest way to get anybody in that practice right now? And if you've got a bunch of enthusiastic staff that have some time on their hands, you get them on the phones, you get them sending out emails, you get them writing letters, physical letters out to all of your database and getting all of those inactive people who haven't been in the practice for 6 months or more back into that practice. You get the treatment coordination team on the phones to the outstanding treatment list and get those people called in for their consults. And we're going to do a stability check. We're just going to do a stability check. We're just going to make sure everything's stable. But say you don't have those resources. Say you don't have a crackerjack treatment coordinator team that's available to jump on the phones. And say you don't have a bunch of people that are available right now to get outflow done, to get people in via letters and email and telephone calls. Well, then you want to get some automation tool. We have an automation tool, Bloomberg Digital. Amy, as you well know, that's the digital reactivation campaign. Ask yourself this question right now. If you got a phone call right now from a number you didn't recognize, Amy, what would you do?
Not answer it.
Not answer it. Everybody says the same thing. And say you got a piece of mail in medical facility or something like that, and it was just, you could tell it was just a printed label and there's no handwriting, it wasn't personalized. What priority mail is that going to be for you?
Into the shred.
Into the shred.
Into the shred.
Yeah. I'll generally open mine most of the time, but sometimes it'll just go straight in if it just looks like, typical bulk mail. How about this? You get an email from a doctor's office. Where does that stand on the priority, 1 being highest, 5 being lowest?
Well, for me, it's 1. If it's my doctor,
yeah.
If it's someone I don't know, I probably forget about it.
Yeah, but I want you all to think with what Amy just said, from a doctor's office, and if it has that doctor flair in it, okay? So it's not like, hi, we're just checking in, right? It's a little bit more like you've missed your appointment. It's quite critical that we reschedule that. People with healthy teeth and gums live longer, and people who have unhealthy teeth and gums are more susceptible to a number of illnesses and systemic conditions. So that being said, we need to hear from you quick to, so that's got a little bit more of a connected to it. So email. And then, of course, our digital reactivation program, which is a texting and emailing program to get your patients contacted in volume. Roughly 200 to 500 per week are getting personalized messages sent out to them, and they respond. Now, what will happen in that? You get some people say, that's a wrong number. Good, update your database. I don't live in town anymore. Update your database. You just texted my dead wife who, I just got over, and 2 years ago, we lost her, and now you've just opened I'm so sorry. You're going to send him flowers. You're going to apologize profusely, and you're going to update the database. And then you're going to get a bunch of other people that are going to jump on board and say, I was just thinking about you, but I forgot the name of my dentist. That is what happens, and you cannot, suffer the recoil of the blowback you're going to get when somebody says, it's a wrong number, this is that, my dead wife. You're going to handle that because you need to handle that. But out of that, say that's 5, 10, even 20, say it's even 30 people that have blowback on it. What about the 120 that go, gosh, I was thinking about, I need to get my dental appointment. And you're there for the 120 or the 50 or the 30. Man, if you had 30 blowback and 30 on, that came back in and got healthy, that's well worth it. So this is something you need to think with. You might not have the resources. Jump on the digital reactivation program. It's the most inexpensive marketing campaign that we have in our company, yet it is one that I'd say historically, Amy, 10x return on investment. So whatever you spend, it's going to make you about 10x. And that'll roll for a few months, but not just that. Then you can move off of reactivation and into special offerings. Hey, an Invisalign campaign, or this much off whitening, or come in for a smile makeover consultation, or we have all sorts of campaigns to get people into your practice, because it is bodies in the shop that you want. You want to just take them in. You want to, no pressure, no weird, just you're going to get them in. And you're going to make sure they're taken care of. You're going to make sure they're healthy. You're going to make sure they're happy. If they're all healthy, you're going to say, good. Are you in love with your smile? You just got to ask that question. Are you in love with your smile? And you're going to shut up. Are you in love with your smile? And you're going to shut up. And you're going to let them think about that. Am I in love with my smile? I kind of like my smile, but I say, oh, really? What aren't you in love about? Well, they got these little stains here, and they say, hey, a little chip back there. Ask that question. Make them fall back in love with their smile. Person who's got, a big smile that they're confident about and they're happy with, man, they're confident in life. So this is what you're doing. You're taking care of people. So some tips on that.
And that's a good tip, because you said that and I immediately thought, am I in love with my smile? Not 100%.
Yeah.
Great. Thank you, Dan.
Yeah.